Good morning, good evening, good night,
Uh,
doctors, nurses, and pharmacists. I'm Dr. Che, and today we will discuss some important OET speaking tips. Yesterday we have done OET writing, and the day before we have done OET reading, and tomorrow we will do OET reading again. Okay. So in this class, what we will do is we will do one or two role plays for doctors, one or two role plays for nurses. We will do like the real exam. You will be the doctor or nurse, I will be the patient, and you will do the role play in 5 minutes, and then I will give you the feedback in detail. Okay. So this is your role play, doctor. Can you hear me, doctor? Dr. Kamar, can you hear me?
I have little issues with the
So let us give
network.
chance to someone else because as we will be
Yes.
recording this class also. So any doctor who has good internet connection and wants to do the role play, please. Any doctor who has good internet connection and wants to do the role play. Anyone? You don't need to be very, you know, yeah. I will teach you, don't worry. Galaxy, are you a doctor or a nurse? Are you a doctor or a nurse? Can you hear me? Recording. Okay, okay, doctor. So your name, please.
Sayyid Asadullah, sir.
Okay, so Dr. Asadullah. So this is your role play. You have two and a half
Okay.
minutes to prepare, please, for this role play.
Okay,
Okay, your
okay, sir.
time starts now. So after 2.5 minutes, we
Okay,
will start the role play. Okay.
okay.
क्या pronounce हुआ CHE DrChe
Let me know, doctor, when you are ready. Dr. Asad, can you hear me? Please unmute and you can participate. You can start your role play. So this is no nursing role play because doctors were not ready for the role play. And who will do? Your name, please.
Rosina.
Okay. So Miss Rogina will do this role play. You have 2.5 minutes to prepare, please. Your time starts now.
Okay, sir.
It's 2.5 minutes to prepare. Rest of the people, please mute yourself. Let me know when you are ready, please.
Okay, sir.
If you wish, you can open your cam. It is not obligatory, it's optional for you. If you want, you can open your cam because I will be recording this class for YouTube. But if you don't want, there is no issue. So if you want, you can open. It is optional for you. So let me know when you're ready. So it is almost we have spent 3 minutes, more than 3 minutes.
Okay, sir. I can
Yes.
start.
Let me start timer here. Just 1 minute.
Okay.
Okay. You can start now, please.
Okay, good afternoon. My name is Rosina Shrestha, one of the registered nurse working in this clinic, and I'll be your attendant nurse for today. May I know your age, please? May I know your name, please?
Yes, yes, nurse. I am Diana.
Okay, how may I address you?
It's okay to call me Diana.
Okay, Diana. May I know the reason behind your visit today?
Yeah, I am here, nurse. I want to see the doctor, a
Yeah,
lady doctor.
definitely you can able to meet the doctor, but before, could you please tell me the reason behind your visit so that I can help you with that, or I can inform to the doctor regarding your condition. So could you please tell me that?
Doctor is actually nurse is something personal, so I want to discuss with the doctor directly. Please, can I see the doctor? Is
Diana, I completely understand your situation. I know you are I know you are having some problem. That's why you are here to get some help. But if you let me know about your problem, I can help you with that. And please, you don't need to be embarrassed because everyone gets some sort of problem in their life, and it's totally fine. So could you please tell me if you don't mind?
Yes, nurse, I'm here because I want morning pills, actually. I'm sorry.
Oh, Diana, now I completely understand your situation. So don't worry, it's quite normal for the teenage girl. So I will help you with that. So could you please tell me your age?
Yes, I am 15-year-old.
Okay, thank you for the information. So Diana, first of all, I would like to inform you that if you want to take the oral contraceptive pills, it's completely fine because it's your right to take the pills. Um, it's your right to take the pills, so it's all right. You can explain me everything, or you can ask me any concern that you want to go through. So I'll help you with that.
Yes, nurse, just I want these pills, just please, and don't tell me my family, as you know, my family is religious, and I don't want them to know about my issue. And please don't tell them.
Okay, your worries are understandable, Diana. So, and if I were in your position, I would also ask the same question. It's quite normal, and let me assure you that whatever we discuss between you and I, it will be totally confidential. So, I won't tell you anyone without your permission, even your parents and doctors. So you can trust me. Are you getting my point, Diana?
Yes, doctor, yes, nurse, just 1 minute. Okay. Yes, nurse, but thank you that you will not tell my parents, but I'm totally embarrassed, nurse. I don't want to get pregnant even after taking these pills.
Yeah, Diana, uh, I do understand your situation and I can sense where it's coming from. So I can give you these pills once I examine you. And let me inform you that once you take the pills, I can't make sure that it's work properly because it has some failure rate as well. So after taking the pills, after few days I will let you know when to do, but you have to do some pregnancy test as well so that we can make sure about that you are totally fine. So is that okay for you?
Okay, now so I need to do some extra things apart from these pills.
And no, Diana, you don't need to do anything apart from this. Just you need to once check your pregnancy test after you taking this medication. So then everything will be fine.
Thank you, nurse. You're very good, nurse. Thank you. Please don't tell my parents, please.
Definitely, Diana. I won't break our confidentiality, so you can trust me, and I will assure you that it will be between us.
Thank you, nurse.
Thank you.
So, what should be her score? People write in the chat. Have you already taken OET?
Yes, sir, once.
It looks that you have already taken OET. So, people, what should be her score? Write in the chat. And today, people are not, active in participate in the class. You just want to listen. You don't want to participate in any way. So, what should be her score? Write in the chat, please. What should be her score? 330? Anyone else? 370? You can just say B, C plus C like this, okay? It's very good, okay? So you have done role play very good. So the main issue here in this role play, so people are saying B, B plus is good. You will definitely get no C plus, no. She will get B grade. So just you need to ask the age of the partner of this patient because if the age of the partner is, above 18, there is something different, okay? In UK, for example, if the if the patient is 15-year-old and the partner is above 18, so you need to inform legal authorities, okay, police and other authorities.
Okay, sir.
So this is not, you don't need to know this, but there was a question to ask about partner age. You just need to ask it, okay? You have skipped this question. It's not a big issue because this is not, exam of asking questions. So this is exam of English, okay? So if you skip even one small question, that is not a problem. Overall, your English is good. The main thing in this patient was reassurance and confidentiality, okay? And this is mostly in nursing role plays. This is the common thing that you need to reassure the patient again and again. You have to, give the patient reassurance, and you have to give confidentiality to the patient, okay? You need to be very polite. The patient can be, very harsh to you, to the nurses. They will be fighting, they will be having hard words, okay? So, but you need to be polite, okay? The
Okay, sir.
nurses, all of you. Doctors also, but mostly nurses. In nursing role play, mostly you will see angry patients, difficult patients like this. So at the start, you should have asked my age at the start. When you asked my name, you should have asked my age also. You were asking later on. You should have asked at the start. Okay. You said, what is the
Oh,
what is the reason behind your visit? It's okay, it's acceptable, but does not look very good. Okay. What is the reason behind your visit? Okay. So you can say, could you please tell me how can I help you today? And when I at the start, okay, my name is Diana. I am here because yeah, like me. You see that patient is a little bit, low. Okay, like
okay.
battery is dead. Okay, so my battery was dead. You should be at the start. You should be uh, Miss Diana or Diana. I can see that you are talking in low tone. You look upset. Okay. Miss Diana, I can see that you look upset. Is everything all right with you? Or is anything that I can help you with? So if what have you heard that, and I will be looking down, what you heard, what you have seen, if you verbalize it, you will get good marks because in OET, you will not only get for just for talking, you get marks just for talking. You also need to see non-verbal cues of the patient, okay?
Okay, sir.
Non-verbal cues, this way I'm shy, I'm looking down, I'm anxious, I'm just shaking, I'm anxious, okay? So these are non-verbal cues, okay? So if I, for example, if I don't want to answer anything, so I will give any signal, okay? So these are non-verbal cues, so you need to be careful about that, okay?
Okay, sir.
So so when you are talking to the patient, be very polite. So you have done very well. This patient was not easy to convince to tell the reason. So you showed confidentiality, you showed reassurance. So it was good, it was excellent. Okay, so it was good rapport with the patient. Okay, so there are no need to say if I were you, I should have done the same. I will not say it is wrong, but we should avoid it to be more professional, to look more professional. So just avoid giving your own example. Okay, I'm not saying at all that it is wrong. Okay, but just avoid it. Okay, you can say. Yes, Diana. Yes, Miss Diana. Only Diana is enough because it's 15-year-old. Yes, Diana, I totally understand your concern, and there are many girls of your age that they might have similar issues, and please don't worry. We're here to help you. Okay,
Okay, sir.
Miss Diana, definitely we will provide you the contraceptive pills that you require, but. Yeah, could you please tell me before what is the age of your partner? Okay. Okay, so after you tell you after you tell so the confidentiality about parents was good, okay? So you have explained the failure rate also good. It was overall it was good role play, excellent, okay? So at the end you will ask, do you have any other concern? I will say yes or no. Okay. So overall it's
Okay.
good role play, okay? So now
Thank-
any doctor who wants to do the role play, then we will do the role play again for a nurse, okay? Any other nurse. So any doctor who wants to do the role play, otherwise we will continue for nurses, okay? Any doctor who wants to do the role play? No? If you don't do very good role play, don't worry. I will explain you each and everything, okay? Any doctor who wants to do the role play? I think there are no. How many doctors are there in the class? How many doctors are there?
Sir,
Yes, please.
sir, I am ready, but
Internet issue. Okay, any doctor who has good internet connection and wants to do the role play?
Yes.
Okay, so this is your role play. You will have two and a
Okay,
half
sir.
minutes to prepare for this role play, and then we will do the role play. You will be the nurse, I will be the doctor,
Yes,
I
sir.
will be the patient, and we will do the role play 2.5 minutes
Okay,
from
sir.
now, okay?
Okay, sir. Yes, sir. Hello, sir.
Yes, please.
Yes, sir. Start.
So are you ready?
Yes, sir.
Okay.
Okay, sir.
Okay, start please.
Yes, sir.
Just 1 minute, let me start timer here.
Okay.
1 minute. Okay. Start please.
Yes, sir. Okay. Good evening. Please be seated.
Yes. Can you hear me?
Yes, sir. Let's start it.
Yeah, start again, please.
Good evening.
Good evening.
Please be seated.
Thank you.
My name is Mohammed Majid. I'm one of the registered nurses working in this suburban clinic. How may I help you?
Nurse, I'm here because I'm concerned as my daughter has a pale color of her skin.
Okay. Okay. Before proceed, for my documentation purpose, tell me name and your age, please.
About my daughter?
Your name.
Yes, I am Diana and I have 30 years.
Yeah, tell me your name. Diana, right?
Yeah, I'm Diana. Yeah, thank you.
Okay. Okay. Okay, Miss Diana. Could you tell me more about the jaundice? Could you tell me? Sorry, sir. Before proceed, I would like to ask some few questions for your daughter condition. Shall I proceed, Mr. Diana?
Yes, please.
Okay, Miss. Okay, thank you, Mr. Diana. Uh, uh, which site which site are you seeing in your daughter jaundice?
Yes, nurse, actually, it started from her face and then it spread to her chest, and no, even her legs are pale.
Okay. How long the time have jaundice?
Actually, it started 2 days ago.
Okay. Okay, Mr. Anna. I really understand. Any other associated for other general symptoms like fever, vomiting, uh, any other symptoms? Do you have your daughter?
No, no, she just jaundiced only.
Okay, Mr. Diana. Mr. Diana. Thank you for information. For daughter condition. Based on information, no need to worry, Anna. Let me reassure you. The jaundice is in first 2 to 3 weeks is normal in all children. The liver function is not matured. Are you
Mm.
hello?
Yeah, please.
Are you able to understand, Mr. Diana?
Yes, yes. But I'm really concerned. Actually, as you know, nurse, someone told me that it could be due to breastfeeding because my husband was saying that I should feed her as much as possible. So I was just breastfeeding her, and someone told me that could be the reason of her pale color.
Okay, I really understand your concern, Mr. Diana. Uh, let me reassure Mr. Diana. The breastfeeding is not cause of this issue, this condition. Uh, are you able to follow me, Mr. Diana?
Yes, yes, yeah.
Okay, Mr. Diana. Now I would like to I recommended to you your the breastfeeding is continue. This is for the this is for improve for breastfeeding is mother increase your immunity, less infection for your child, and contain balanced amount of minerals and proteins are uh, is there in the breast milk. Are you able to understand, Mr. Diana?
Yes, yes, yes. Okay, okay.
Do you
So
have
should I
any other
continue?
concern?
Should I continue breastfeeding?
Yes, Mr. Rania, really good question. Yeah, yes, it's absolutely. Yes, this is good for your health in your child. Breastfeeding only, your child is better for our health, and
Okay.
also improve immunity, improve your child's immunity. No need to other related issues. This causes for breastfeeding. Are you following me, Mr. Diana?
Yes, yes.
You have any other concern, Mr. Diana?
No, no, no. Thank you, doctor. Thank you, nurse.
Okay, Mr. Dana. Okay, thank you, Mr. Diana. I would like to some advices to give you. Our baby is sunbathing of the because the reason for jaundice sunbathing morning and afternoon 15 minutes each daily automatically prevent reduce the jaundice. Are you following me, Mr. Diana?
Yes, yes.
Uh, do you have any other queries, Mr. Diana?
No, thank you, nurse.
Okay, Mr. Diana, you let me quick summary. You came for concern for your son's jaundice. I will explain you. Your doubt is maybe cause of breastfeeding related jaundice. I will explain breastfeeding is a best for your children's and health. No issues for related this problem. And continue breastfeeding and take sunbath your prevent for jaundice. Uh, you are understand everything. Thank you for cooperating, Mr. Dayana.
Thank
Uh,
you, nurse. You're a very good nurse. Yeah.
if you have any, okay, thank you, Mr. Dayana. If you have any queries, I will give you a number. Please do not hesitate to contact me, Mr. Dayana. Thank you for
Uh,
cooperating.
Thank you,
Thank you,
nurse.
Mr.
Thank
Thank
you.
you. Thank you.
So what should be the score? Please write in the chat. What should be the score for this nurse? If you are a doctor and you are in the class, don't worry. Overall, the things are same. Okay, the same role play. We can change a little bit, and we can do for doctors also. If the patient comes with jaundice, a baby comes with jaundice, you will ask these questions. You will explain these things. So almost there would be no major difference between nursing and doctor's role play. So if you are in the class, don't worry that you are wasting your time. Okay, so what should be the score? Write in the chat, please. What should be his score?
300, 280,
260 होइन
Nah, ya
लेख्यो त
कमजोर नमरे बिपी तारा रेकॉर्ड कर दियो
So which language this one?
सी बंद करें
Miss Nilofer? Ah, no, muted, yeah. Which language this one that she was speaking?
sorry
sir this is Pashto sorry
Okay. So my question is, you are the examiners and you have listened to two role plays. One role play that you have already done, we have already done, and this was the second role play. And for one nurse, you have given B grade. For other nurse, most of you are saying C or C plus. So why? Why you are going to fail your colleague? Yeah. What is the reason? Can anyone tell me? Can anyone tell me, please? Why? Why you are giving C plus or C? And for the other nurse, B grade. Why? So let's see in the chat because you people don't want to participate today. I don't know why. Repetition of word dhyana, grammar, vocabulary, repetition. What is the assessment criteria? I will explain assessment criteria. Are there already no fluency, hesitation? There already YouTube on my YouTube channel. There is a video in which I explain all the assessment criteria for OET speaking. So you can watch that one. So it means you are good examiners because you can easily differentiate between B grade and C or C plus grade. Yes or no? Can anyone talk to me, please? Just I'm speaking and I'm speaking.
Yes, a little bit.
Yeah. So you are good examiners because you can differentiate between B grade and C or C plus. You cannot explain it because, okay, so you are not explaining anything, but overall, it's true that this role play was C, C plus, other role play, even C plus, no C. Other role play was B grade, but don't worry, Nurse Muhammad. So I will explain you where you need to improve, okay? So, yeah. So first of all, first let me tell you first your mistakes and then we will try to improve, okay? So there was no need to say, good evening, be seated. There's no need to say seated, okay? So the patient will already in front of you. You have talked to the patient for 2 minutes at the start. That is warm-up session, the real exam. So the examiner will ask you your name, your age, what are your future plans, okay? Your education, your specialization, your current job, whatever. They will ask you some general questions. Where are you from? Like this. So in these 2 minutes, just building good rapport. After that, they will give you 2 to 3 minutes to prepare for the role play. And after that, you will do the role play. Okay? There is no need to say, please be seated. Good evening. Good evening is okay, but please be seated. No. So first of all, I told you, you said you need to say this. Good morning, Diana, or good morning. I am Muhammad Majid, one of the nurses here in this suburban clinic. How can I help you today? You can say, may I know your name, please? No, you don't need to know the age because here the patient is the daughter, not the lady. Okay. May I know your name, please? Yes, yes, nurse. I am Diana. Okay, Miss Diana, I can see that you are here with your two. I can see that you are here with your little daughter. How can I help you today? Why I am saying you are here with your little daughter? Why? Can anybody tell me? Can anyone tell me why?
So that you can assist her child and diagnose the jaundice, whether it is right or
Yeah,
not.
it means you are active. You are active in seeing patient's issue and seeing you. So in the your role play, you already know that the patient is the baby, not the mother. Okay. So when you mention the baby, it means you are already alert and you are concerned that the patient is baby. It will look good, but it's not obligatory to say like this. Okay. But if you say this, it will look good. Yes, nurse. I'm here because my daughter is she is having pale color. So after I told you John's dust or pale color, whatever, you need to give me some sympathy, okay? Miss Diana, I'm really sorry to hear that. Miss Diana, I'm sorry to hear that. Could you please tell me a bit more about her pale color? Or if I say jaundice, could you please tell me a bit more about her jaundice, okay? Could you please tell me a bit more about her pale color? This is an open question. You need to this is like interview. And these things are mentioned in OET assessment criteria that you need to do. And whenever you do any, English, sorry, any medical exam also, you need to do these things when you're talking to a patient. So at the start, ask an open question. What was the open question? Could you please tell me, Ms. Diana, I'm sorry to hear that. Could you please tell me a bit more about your daughter's condition or about your daughter's pale color or just about daughter's condition? Then I will give you some more information. Then you need to see if there is some question is missing, some answer is missing from the first site duration and fever and these things, then you will ask them separately. And you are not able to make grammatically correct sentences, questions, okay? So ask an question, could you please tell me, Ms. Diana, I'm sorry to hear that. Could you please tell me a bit more about your daughter's condition, or could you please tell me a bit more about your daughter's pale color, okay? So then you ask site. So how we will ask about the site? Can anyone make a question about the site?
Where does exactly it hurt? About the site?
That's it, directly site. Okay. So what else you will say?
Or we can ask like, could you please tell me where have you noticed that pale color, especially?
Where? Yeah, where? Okay. Yeah, good. Okay. Good. Yeah. I will say if it started on face and then it moved to her tummy and then even now she's having on her legs also. So this is what is the site of jaundice? It looks like robot thing. What is site of jaundice? What is the duration of jaundice? What is association of jaundice with other symptoms? No, no, no. These are just hints for you. You will make your own questions. Okay. And duration. Since how long uh, uh, she is having jaundice? Okay. Okay, like this. So, does she have any other symptoms like fever? So, make questions like this, okay? So then you reassure Miss Diana, let me reassure you that. So give a good reassurance, okay? Let Miss Diana, let me reassure you that it is quite normal for first 2 to 3 weeks of babies to have jaundice like this, because no, this that is in the bracket, this is your explanation why there is jaundice. Okay, so let me reassure you, Ms. Diana, that it's quite normal for babies to have jaundice like this in first 2 to 3 weeks of their life, because their liver is not mature at this age. Okay, so that liver function does not fit grammatically. So their liver is not mature at this age. Okay, then okay, nurse. So ask about feeding. So could you please tell me what she drinks? Okay. Are you giving, are you doing, is she breastfeeding only, or do you give some formula milk also? No, no, she is just breastfeeding. Okay. And then I will tell you that, uh, I have stopped the breastfeeding now. Someone told me that because her reason of jaundice could be the breastfeeding. So that is why no, I am not breastfeeding. I have just stopped. Then you need to reassure me again, okay? You don't need to say again and again reassure. Okay, Miss Diana, let me tell you that breastfeeding is not the cause of jaundice. Even it could be the treatment of jaundice, because if you keep breastfeeding your baby, she will not be sick, and her jaundice will improve with time if you keep breastfeeding her. Ah, okay, okay. And okay, let me tell you, there are some advantages or benefits of breastfeeding. If we breastfeed the babies at this age, it increases their immunity, and when their immunity is increased, there are less chances of infection. Don't say, just read. You have said like this, okay? So breastfeeding increases immunity, less infection, and contains a balance, this and that. This is just you are reading from the role play. You are not making your own sentences, okay? So it increases immunity, that results in less infections, less number of infections, less severity of infections. And other thing is that the milk, the mother's milk contains a balanced amount of minerals and proteins, and that is why it is good for the baby. Okay, and it provides balanced nutrition for the baby. You can say like this. So sunbathing, you will say, okay, Miss Tiana, at the end, I would advise you. So this is advice. I would advise you to sunbath. To sunbath, you need to use the verb to sunbath your baby for 15 minutes daily in the morning and afternoon. Okay. Do you have any other question? Yes or no? You don't need to say, you don't need to summarize. At one place you can say, do you want me, Miss Diana, do you want me to summarize what we have discussed so far? In one case also, when there is you are in doubt that you have completed your 5 minutes or not. But in this role play, you say there are a lot of bullet points. You must have completed your 5 minutes, and you have done the role play in 7 minutes. Okay. So can you do the role play again, please? You have Dr. Mr. Muhammad. Can you hear me?
Yes, sir.
Okay, so 2.5 minutes again for you to prepare for this role
Okay.
play. Just keep in mind the points that I have given you, the tips that I've given
Okay.
you. Keep in mind
Okay, sir.
and prepare this role play again for 2.5 minutes,
Okay.
and we will do the role play again. Okay. So I want,
Okay, sir.
I want, I want to see how you will do a better role play. Okay.
Okay,
If
sir.
you have
Okay.
any question, you can ask me during preparation. Okay. Even I will
Okay,
give you
sir.
3 minutes. You can ask me any questions. So you will keep in mind all the points that I have given you, all the tips.
Okay.
So try to do a good role play this time. Okay. 3 minutes from now to
Okay.
prepare again. Okay.
Okay, sir.
By the way, is Mr. Diana? No, is Miss Diana? You were saying Mr. again and again. Is Miss Diana?
Okay. Okay.
Okay.
Okay.
Your time starts now. Okay.
Okay, ma'am. Okay. Sir,
Can we start now?
yes, sir.
No, there was no voice because he was preparing for the role play like the real exam. So you will have 2 to 3 minutes to prepare for the role play. And then we will do the role play. Now let me start the timer.
Okay, ma'am.
Just 1 minute. Okay, start please.
Okay, sir. Good morning.
Good morning.
My name is Mohammed. I'm one of the registered nurses working in the suburban clinic. How may I help you today?
I am here because my daughter is having pale color for the last 2 days.
Oh, okay, I'm sorry to hear that. Uh, 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 my recording, uh, uh, my recording purpose. How may I address you?
I am Diana. You can call me Diana.
Okay, Miss Diana, you gave it data. Uh, um, could you tell me more about your daughter conditions?
Yes, doctor. Yes, nurse. Actually, as you know, she is just 2 weeks old, and she started having pale color from her head and from her face 2 days ago, and then it spread to her tummy, and then even now her legs are also pale. I'm really concerned about her pale color.
Okay, I really understand your concern, Miss Diana. How long how long mm, uh, how long these conditions have?
As she's having pale color for the last 2 days.
Okay, o- uh, okay. Uh, any other any other symptoms like fever, vomiting is other symptoms have you have?
No, she just having pale color, nothing else.
Okay. Uh, okay, Miss Diana. Thank you for information. Uh, let me reassure you, Mr.
Miss,
Let me
Mr. No,
reassure you,
Mr. No,
Miss.
Miss.
Let me reassure you, Miss Diana. This is jaundice is normal in first 2 to 3 weeks. No need to worry. Uh, your daughter still liver functions is not mature this week. Uh, are you
No,
able
I
to
will
follow
get
me?
worried. I will get worried when you say my daughter's liver function is not mature. Just tell that mostly in this age, uh, baby's liver is not mature. Okay, like this.
Yes, sir.
So tell me again,
Yeah.
reassure me again. Okay.
Yes, sir. Let me reassure you, Miss Diana. This is the first 2 to 3 weeks is normal in jaundice.
Normal in
Because the
jaundice, no.
uh,
Jaundice
uh,
is jaundice
yes, sir.
is quite normal,
Right.
or pale color of skin.
Quite,
Jaundice is
yes,
quite
quite
normal in first 2 to 3 weeks of life
first.
because
Uh,
baby's liver function is not mature. A baby's liver is not mature. Okay.
mature. Yes. Mm. Let me reassure you, Ms. Diana. First 2 to 3 weeks is quite normal in pale color because of your daughter's liver functions not
Doctors
mature.
know just overall, just say overall.
See,
Just baby's liver function is
very,
not, liver is not
very
mature in first 2 to 3 weeks.
normal mature. Yeah, yeah. Okay, okay.
Yeah. Okay.
Yeah. Miss Dana, I will ask you some questions, few questions. Shall I proceed?
Yes, please.
Uh, uh, Baby is feeding. You are what type of feed you? Formal milk or your breastfeeding milk?
No, I was breastfeeding only, but one of my friends told me that breastfeeding could be the reason of her pale color. That is why I just stopped breastfeeding yesterday.
Oh, okay, 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 okay. Uh, no, Miss Diana, no, not a cause of this issues for breastfeeding. Breastfeeding, not causes of breastfeeding. This issues.
Just make it
Uh,
clear. Why you're making it difficult, please? Just make it easy. Okay. Miss Diana, let me tell you that breastfeeding is not the cause of jaundice. Okay. So
uh,
I would advise you to keep breastfeeding your child so that she can recover soon. Okay.
okay,
Because breastfeeding has many advantages like
yeah,
this. Okay. It has many benefits. Our breastfeeding is
yeah,
good for your child. You can say even
yeah,
simple. Okay. Okay,
okay,
nurse, I was just breastfeeding her for the I was breastfeeding her, but one of my friends told me that the breastfeeding could be the reason of her pale color. That is why I just stopped breastfeeding yesterday.
okay, okay, okay.
Explain me.
Okay, yeah, let me tell you, Miss Diana, the breastfeeding is a very, it's not a cause of this issue.
Say,
Let me,
please just don't just read from the role play. It's not the cause of this issue. This is not the cause of jaundice or not the cause of pale color. Okay, don't just read from there. Okay,
okay, okay,
yeah, use your own wording.
okay, okay, sir.
Yes, please.
Yes, yes, sir. Let me tell you, Miss Diana, uh, uh, uh,
Mhm.
uh,
Why?
okay,
Just think in your own language what you will say. In
okay,
your own language. Tell me in your own language what you will say.
yes, sir, okay, okay.
What you will say in your
Yes,
language.
sir, yes, sir.
That breastfeeding is not the
Mhm.
cause of her jaundice. And I would advise you to keep breastfeeding because it is good for our health. Can you tell this in your mother language?
Yes, sir.
What? Okay, just do it again in English, okay? Tell me again.
Okay, sir.
I just
Okay.
start breastfeeding, nurse, because one of my friends told me that breastfeeding is not good for our health.
Okay. Okay, Miss Diana, I tell you, uh, uh, the breastfeeding is not related to these causes of,
Very
no
good.
related to
Breastfeeding, very good. Breastfeeding is not related to jaundice. Very good, okay?
jaundice.
Yeah. I would
Uh,
advise you
I would,
to keep,
I would advise,
yeah,
you keep the breastfeeding,
yeah,
and
because
uh,
because it is good
because
for our health, okay? It would help her
good
to
for the health,
recover. It would
for
help her to
health,
recover. It would help her. It's good for her health, okay, like this.
health.
Okay.
Okay.
Okay. So then you need to explain me the advantages, okay? Okay, doctor, I
Okay.
will try, but still, my friend is my good friend, and she told me breastfeeding is not good for her. Now you will explain me advantages. Okay?
Miss Diana, this breastfeeding is more helpful for an increase for immunity in her
It
child,
increases.
and
You need to use present tense.
increases
Increases immunity of your child.
increases the immunity of our child, and also less
No, no, don't read
infections.
this. Also less infections. No, due to increased immunity, she will have
She
less infections.
we have less infection,
Yeah.
uh, and have and also uh, uh, more condensed, balanced
Don't read the
amount
same
of
thing.
vitamins.
Yeah. And the milk and mother's milk contains mother's
Milk,
milk. You can even say
and the
mother's milk
mother's milk,
contains balanced amount of minerals and proteins. That is why
and
it is best for baby's health. It is good for baby's health. Okay, like this. Yeah.
okay.
Yeah. Okay. Now advise me the last thing.
Mm, la, last, lastly, I some advice to you. Give your babies uh, daily 50 minutes, morning and afternoon. Give the sun bath. Prevents for jaundice in your baby.
It prevents John.
Are
It will
you,
help to help to recover. Okay.
okay.
Any
Are
other
you able to
nurse?
follow
Okay.
me?
At the end, you will ask, do you have any other question? I will say yes or no.
And,
Any other nurse who wants to do the same role play? The same role play in just 5 minutes because we're going to end the class soon. But your English should be good, okay? Any nurse with good English who wants to do the same role play? Nurse, the same role play. You can unmute and you talk to me. You are a doctor? Okay. Can you please
Hello.
unmute? Yeah. Can you hear me?
Hello, sir.
Yeah. So your net connection is now
I
good?
Yes, sir.
Can we do the role play?
Yes, sir.
Okay, let us do one doctor's role play also because we have done two role plays for nurses just to keep the balance. Just 1 minute. Okay, doctor. So the same role play that I have shown you before. So you will have 2.5 minutes to prepare, and then we will do role play. You have already prepared it. 2 minutes to prepare, please. Okay. Just take it 2.5 minutes. Okay. 2.5 minutes to prepare. This is doctor's role play. Your time starts now.
Sir, you have other role plays of medicine.
Yes, please.
Sir, you have other role plays of medicine beside this.
This is why?
Sir, other cards beside this for
Why?
medicine.
You are having an issue with this role play?
Sir,
Imagine if you get the same role play in the real exam. I will explain you. If you have any question, you can ask me before role play. Who is ready? iPhone. Who is iPhone?
Assalamualaikum.
Walaikum.
जी डॉक्टर मैं it's me iPhone.
So iPhone. Okay. So are you going to do the role play?
I can try. This
Let us
is my
ask.
first
Let us
time.
ask first Dr. Kamar if he can do, because he has just started the preparation. Maybe I give you another chance also. So as we have given him the chance, so let us ask him. Dr. Kamar, do you want to do the role play, please? Have you prepared?
sir, keep continuing with her. She will continue.
Do you want to do any other role play apart from this card?
Yes, sir.
Okay, I will
I
give
will
you
do
other card. Okay,
about.
other card. Okay.
Yes.
Okay, doctor. So let me. Are you ready now? Other doctors. So
Yes, I'm
your name,
ready.
please, just for to just
Faika. My name is Faika.
Faika. Okay, Doctor Faika. So let me start timer now here. Just 1 minute. Okay, start please.
Hello. My name is Dr. Faika. I'm one of your doctors in the suburb clinic today. May I know your name, please? Name and age.
Yes, no, yes, doctor. I am John, and I have 80 years.
John. Nice to meet you. Is it okay if I call you John?
Yes, no issue.
Okay, John. Can I ask you how can I help you today with John?
Ah, as you know, doctor, I have 80 years, and I am here because I'm having issue with my lungs, and I don't want this that you people are jumping on patients and when they are dying. I don't want this, please.
I'm really here to say to hear about. Really sorry to hear about this. Can you explain a little bit more? What exactly is your concern?
Yeah, I don't want if I'm as I don't want you people to jump on my chest when I'm dying at the end. There's you people. I don't know what you people say it, but I have seen patients in the wards that you people were doing this and breaking their you know ribs, and I
Yes.
don't want this. If I die, I want to die with dignity.
I completely understand, and I'm really sorry for this one. But I will just like to explain to you what exactly we are doing in that one, and in this one, the one you are calling jumping. It's actually we're trying to save the life of the person by giving him, by compressing his, I don't know, compressing his heart and giving him some oxygen so he can, that heart can start working again. This one, this can happen. Explication might happen if CPR is done. If at the time, if at the time of the this, it's called, basically called a CPR. It is a resuscitation. Like if the person is about to die, we are doing this just to help and revive him back. If it is not done, it can also lead to the death of the person. I'm sorry I have to give this information, but because we are talking about this one, is it okay for you?
Doctor, I'm already having pneumonia and my, lungs are not good. Apart from that, as you know, I have cancer of colon, so I don't have too much time of my life, so I want to die with dignity.
Yes, I
Uh,
understand, and I'm really sorry for your this one. For this, we have a procedure like this. You have to sign a kind of a paper. It's like a do not resuscitate like paper. In case if anything happens, it should be present and available with your signature, and everybody should be aware of it. So in case if anytime anything happens, so that everybody will be aware, and they will not do this resuscitation for you. Um, did I answer all your questions? Is anything else you want to answer for this?
yeah, it's okay, thank
I will book an appointment with you with our consultant with your next visit, and I also will give you some leaflets and the hospital number for any further queries. Thank you.
you.
I don't know. Doctor, my first time, I don't know really what I did.
Don't know, don't worry, okay. Where are you from?
I am from Saudi Arabia.
Okay, okay. You're originally from Saudi or you're living there nowadays?
No, no, I'm living there.
Okay, doctor, so you have done the role play in almost 3.5 minutes, okay?
Mm-hmm.
When I will upload this video on YouTube, you will listen to your own role play, okay?
Okay.
And you will see how fast you are, okay? I can
Okay.
say like this. Okay, so Dr. Feka, your speed is fast and your role play is not good. I will give you C plus grade. You need to improve. You need to be polite with patient, and you don't need to read the role play when you are just reading the second bullet point, and you are talking a lot, and you need to show good sympathy to the patient and decrease your speed, and you are not asking. You have not waited for me to give the answer that you should sign the this DNR, this sign this form. And apart from that, you have not told me that I can change my decision in future. Thank you so much, and your score is C plus. Okay, thank you so much. Yeah, give me $5 for this role. Yeah, is this good feedback?
No, no, of course. Yeah.
So this is just think that. Just think. Your English is not an issue. Okay, your English is good. Just think you are talking to a child. Okay, you're explaining this thing to a child. Will you explain to a child like this?
No, I'm sorry, doctor. My children are here, so I'm muting. But I'm listening to you, huh?
Okay, no problem. Okay,
Okay.
so no problem. So, doctors, you don't need to hurry up. Just when we have kids, okay, just think that you're explaining to a child. Okay, so first of all, you need to decrease your speed. As I'm saying, I can say all of these things in one go. You need to do this, 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 this. You need to improve this, this, this. But why I'm telling one by one and explaining? Because I'm explaining to a student, okay? Okay, you need to decrease your speed. And you don't need to say, is it okay if I call you John? No. Call me Mr. John, okay? If you say, is it okay if I call you John? I will say, okay. I will not reduce your marks, but just call Mr. John, okay? Because in OET, you need to be respectful for the patient. So in the first role play, in the role here you were reading some, you know, you were not sure what you were going to say. You were reading from here, okay? So chest compression, artificial. Even in the real exam, if you get any point, at any point, if you don't remember what you're going to say, you can accuse the examiner. So could you please give me a few seconds to see the role play? Is okay, it's not a problem at all because you forgot. You're blank, okay? But don't do this without asking, without signposting what you are going to do. You were talking with me and then you started reading role play, okay? So you will ask the role play. Okay, good morning, John. I'm Faika, one of the doctors here taking care, one of the doctors in this suburban clinic. How can I help you today? Or is there any concern I can help you with? Or, or how you are doing now? As you know, this is already admitted patient. How you are doing now? Okay. So I will say, yes, doctor, I'm doing same, but as you know, I am here because I don't want doctors to jump on me. Yeah, I'm sorry, Mr. John, about your condition. And could you please tell me what you mean by you don't want the doctors to jump on you? Ah, yes, yes, yeah, when the people are dying, you people are jumping, and I don't want this for myself. Okay, Mr. John, I understand your concern. May I know, please, why you don't want this for us to do for you? Ah, because I have pneumonia and I have this cancer and I want to die with dignity and this and that. Okay, Mr. John, we respect your opinion, but do you know why we do this procedure? No, doctor. We call it as we call it as CPR, cardiopulmonary resuscitation, CPR. In simple words, this is an emergency procedure when someone's heart stops beating or or there is issue with his chest, okay, he stops respiration or he stops breathing, simple words, and stops breathing. We do these chest compressions and we give them artificial breathing so that we can preserve their blood circulation and we can avoid cardiac arrest. Now patient will understand why. So what is this procedure? So then you will ask, okay, do you understand, Mr. John, what is CPR? Yes. And do you want us to do this procedure if something similar happens with you? No, no, doctor, I don't want at all. I don't want this. Okay, Mr. John, do you know what could happen if we don't do this for you or for any other patient? Yes, I know I will die. It means the patient knows what this procedure is for. Okay, he said, I will die. Okay, Mr. John, as you know the consequences and what this procedure is for, and you still don't want us to do this role play for this procedure for you, then you need to sign a form that we call as do not attempt cardiopulmonary resuscitation form. So you have to sign this form for us. Could you please do that? And when you explain me, so you have to sign this form, and then you continue telling me other things. You didn't wait for me to tell that I'm going to sign or not. Okay, so this is not good. Okay, so I will say, okay, doctor, I will sign. There is no issue. I will sign that. Okay, okay, Mr. John, do you have any other concern? No, doctor, no, I don't have any other concern. Thank you. So, Mr. John, in case if you change your decision, let me tell you, Mr. John, in case you change your decision in future anytime, you can contact us and we will change your decision and okay, so we will do CPR for you in case if something happens similar with you. Okay, so you need to tell this also is important. Do you have any other concern? Yes or no? Okay, thank you, all of you. Any question? Anyone wants any question? We will end the class because it's already too long. So, Doctor, what, Doctor, so sorry, Dr. Kamar, just remind me to do role play with you in next speaking class, okay? In next speaking class, I will do role play with you. So thank you so much, all of you. Do you have any question?
Sir,
Yes, please.
can I ask you a question related to writing?
Yes, please. Next
Okay.
class is tomorrow. Next class is tomorrow, and tomorrow we will do the reading, okay?
Okay.
Yeah.
Sir,
Yes, please.
if the patient is admitted in hospital and they are in critical condition or they might be intubated, in that condition, if I have to write the letter to the GP, it could be a update letter. So, and that letter, soon after indent, should I start to write with current health condition or the just from the starting?
So please send me the case notes. Is difficult for me to explain like this, okay? So send me the case notes on my WhatsApp. I will see the case notes and send me your letter, or you can ask me question accordingly, okay? So I can explain you well instead of explaining like this, okay? So
Okay,
you have
sir.
my WhatsApp, you can send. So if anyone wants,
Sir,
if any of you wants to feedback, individual feedback, paid feedback for speaking or for writing, you can contact me, okay? Any other question?
sir, when will be the next session for the speaking class?
Tomorrow we will do reading, and on Monday we will do writing, and on Tuesday we will do speaking.
In the same timing?
Yeah, almost same. Yeah, I
Is
will
it 1 hour
update in the group.
class?
Yes, please.
Is it 1 hour class?
Yeah, almost 1 hour. It could be something less, something sometimes more. Almost 1 hour.
Yes, sir, because I was ready and I was in need of your feedback. Like, I
Yeah,
wanted to know where do I stand.
no problem. I will. I will. Okay. So tomorrow reading.
Should I wait
Okay.
for should I wait for Tuesday for the speaking feedback?
Yeah, for free feedback till Tuesday. Okay.
Yeah.
When is your exam?
Sir, it's too near. How if you could ask me now?
When is your exam?
Sir, in fact, it would be in the 29th October.
29th. You still have enough time. Okay.
Okay,
Enough
then
time.
I'll be
Okay.
waiting for Tuesday.
Thank you so much, all of you.
All right.